Hey everyone, I just was joined by Oliver here. So this is Dr. Hall behind Oliver's butt, and we're gonna finish off our lecture on action potentials by talking about some unique characteristics that are going to be important. So the way this kind of fits into the whole lecture here's a little quick review. So in the beginning, we talked about how the plasma membrane is semi-permeable. So large or polar molecules or ions cannot freely cross. So you need to have ion channels. Those ion channels may open in response to binding of a molecule. Those are called ligand gated. In response to voltage changes, those are voltage gated. In response to mechanical things, we're going to come back to those later, or they might always be open, in which case they are leak channels. And once channels open, then an ion will move according to its electrochemical gradient. So according to the charges and according to its concentration gradient. So that combination, there's the Nernst equation, you can kind of figure out where its equilibrium potential is, where the amount of an ion moving in one direction will be balanced out by the amount of that ion moving in the other direction. And then you can use that to predict which way the ion is going to move. So that was 3A. In 3B, we talked about reaching threshold. So all neurons are constantly receiving signals from other neurons or other things if they're sensory neurons. And so those can be excitatory, EPSPs, or inhibitory, IPSPs. So excitatory ones are ones that briefly move the membrane potential less negative, closer to zero, depolarize it a little bit towards that negative 55 membrane potential for threshold. IPSPs are ones that allow ions to move in such a way that it makes the inside of the cell more negative and moves you farther away from that threshold. So depending on all of those inputs that are happening, now remember these are via neurotransmitters from other neurons. These are ligand-gated ion channels, and these are brief, and you can have a bunch all at the same time. That would be spatial summation, or you can have a bunch right in a row, and that would be temporal summation. And when it all adds up, if your membrane potential is negative 55 millivolts, if it hits that level, then the axon hillock is going to send an action potential. So in 3C, we talked about what happens then. So at the axon hillock, those voltage gated sodium channels open. Because of its electrochemical gradient, sodium ions rush into the inside of the cell, making it relatively more positive. So it's depolarizing, becoming less negative. Then the potassium channels that are also opening in response to voltage changes, but are a little bit slower to do so. So they open, but then potassium moves along its electrochemical gradient, which is actually to move outside of the cell. Yeah, there we go. So the inside of the cell becomes more negative and repolarizes. Now remember, this actually even goes into undershoot. It becomes more negative than the resting potential, and then the sodium potassium ATP pump is going to kind of put everything back to baseline. So what we're going to talk about in this last section is refractory periods, the direction of travel of the action potential, the speed at which it travels, and then the overall strength of a signal from one neuron to another. So this is just that action potential overview slide that you saw before. So again, we're moving from the axon hillock down toward the axon terminals due to, summation of EPSPs and IPSPs that get sufficient to depolarize the cell to negative 55 millivolts or threshold. And then it's an all or nothing thing, and it only goes in one direction from the axon hillock to the axon terminals. So the first thing we're going to talk about is refractory periods. If something is refractory, that means it's kind of like recalcitrant. It doesn't want to do the thing. That's what refractory means. It can't or won't do the thing. So a refractory period in the term, when we're talking about action potentials, is a time after an action potential happens during which the neuron is either incapable or less capable of firing off another action potential. So there are two different types of refractory periods that we're going to encounter. One is the absolute refractory period. It's like, no way, no, I cannot send an action potential no matter how much you try to make me do so. And then the other one is a relative refractory period. So it's like relatively refractory. It's like, I don't really wanna, but if you try hard enough, then okay, I will. So we're gonna take a look at why those happen. So first here, we're looking at a diagram from the Hedges textbook, looking at absolute refractory period. And let me get my highlighter here. Okay. So this arrow here is pointing to during that rising phase when the voltage gated sodium channels are open, sodium is rushing inside of the cell, so the cell's membrane potential is rising, it's becoming less negative. So during that time, you can see here our sodium channels are open. So like we're already in the middle of an action potential. We can't do another one. We're in the middle of one right now. So that's part of the absolute refractory period. The other part happens during this falling or descending phase, which you might remember is when the sodium channels are inactivated. That little bead kind of blocks the pore there. And so no way can sodium go through. So you'll remember that we're falling at this time because the potassium channels have opened and potassium is moving out of the cell. That's why our membrane potential is coming back down and becoming more negative. So during this time that we see here in blue, that is our absolute refractory period. Absolutely no way we cannot send another action potential because either we're already in the middle of starting one or our sodium channels are inactivated. So no go. Then we have the relative refractory period. So this begins at the end of the absolute. So let me change my highlighter here. So our absolute refractory period was this whole section in here. So now we're coming into the relative refractory period. So our potassium channels, where's my highlighter, at this point are open. And so potassium, as you remember, is leaving the cell. And so it is making the cell more and more negative. It is repolarizing. And in fact, it's going into this undershoot where then we're way more negative than even the resting membrane potential of approximately -70, right? So we are so much farther away now from threshold that it's not until those potassium channels close and the sodium potassium ATPase starts to do its job and brings us back to our resting potential here that it's going to be just as easy as it was before to trigger an action potential. So during this relative refractory period, it's just that we have longer to go. We have longer to go to reach that threshold. We have to make the membrane potential even more positive or even more less negative than it was to get from, say, -80 to -55. So the distance that we have to travel now. So it takes a lot more of a stimulus, so more excitatory PSPs, more excitatory postsynaptic potentials in order to trigger another action potential because it's just harder to get to threshold. So that's the relative refractory period. So these refractory periods, and this is just another diagram of the same thing. So you've got the absolute refractory period is this section here. Yes, Oliver. And then the relative refractory period here, where it is impossible or more difficult to send an action potential. So that is going to determine how quickly you can send action potentials because you can't send another one until the refractory period is over. So the refractory period is generally 1 to 3 milliseconds, right? So those are thousands of a second, but it varies from neuron to neuron. We're going to talk a little bit about that in a minute. So if you think about, okay, it's 3 milliseconds, that means I could send about 333 signals per second. That's amazing. It's incredible. It's insane, actually, when you think about it. The other thing that I want to say about maximum firing rate is it's going to be pretty much the same for any individual neuron, given that if the electrochemical gradients are what they usually are. So each individual neuron has its own properties that are going to affect its maximum firing rate, but different neurons can have different maximum firing rates. I know. So let's get into speed of transmission now. So it's going to depend on 3 things: the diameter of the axon, the presence and amount of myelin, and electrochemical gradients. So diameter of an axon. This again is a diagram from the Hedges textbook that I really liked. So larger diameter axons have less resistance to ion flow. I like to think about it as, sometimes you get like a milkshake at McDonald's or Culver's, and if you tried to drink it through a regular drinking straw, it would be really, really difficult. It's a smaller diameter, you're gonna have more resistance. So you have to get the bigger like milkshake straw to actually be able to suck it up. So larger diameter axons have less resistance to ion flow, so ions will flow more quickly if there's larger diameter. Now, interestingly, larger diameter axons, just in general, are also more likely to have myelin and to have more myelin. So really quickly, before I go to the next slide, I just want to show you this little box here, which I really liked. So you can see that the larger the diameter, the faster the transmission, and also the more myelin, and those tend to go together. So let's just remind ourselves about where myelin comes from. If you're in the central nervous system, it comes from those glial cells called oligodendrocytes, and they send out projections like Elastigirl to lots of different axons and wrap around. Whereas Schwann cells are found in the peripheral nervous system, and each single cell wraps itself around just one little segment of an axon. They're very focused, very locked in. They just do that one thing. I also like showing you this image again, so a little quick review of our microglial cells, which are the immune cells of the central nervous system, the ependymal cells, which are creating CSF and using their cilia to circulate it, and then of course the astrocytes, which are important because they make those end feet for part of the blood-brain barrier around our capillaries, and they also modulate synapses with those tripartite synapses. All right, but the point here was to remember our oligodendrocytes and Schwann cells, which produce the myelin sheath. So how does the myelin sheath speed conduction? Basically in two ways. One is that we just have these nodes of Ranvier, right? These little spaces, I'm going to change my highlight color so it shows up better. These little spaces in between, right? These nodes of Ranvier in between all the little sections of myelin. And so what happens with saltatory conduction, which comes from saltare, the Italian or Latin for to jump, is that the signal basically just starts here and then it goes boom, boom, and it goes on down and just kind of skips doop, doop, doop down the axon rather than having to chug, 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 chug all the way down the axon. So that is one way that it speeds conduction. The other way is that there happen to be additional potassium channels in the axon that we didn't talk about previously that are leak channels. They are always open. So think about it. When sodium is rushing in and causing that depolarization, those leak channels are going to let potassium move out, which is going to kind of directly kind of fight and contradict what's happening with the sodium. So that's kind of like an inherent thing that normally slows down an action potential, but myelin blocks those leak channels, so it allows it to go more quickly. The final thing that's going to influence the speed of an action potential, and this is like the whole action potential itself as well as the speed at which it moves down the axon, is what the electrical chemical gradients are. So most of the time our bodies really, really strictly regulate this, right? So homeostasis, a big part of homeostasis is maintaining your sodium and potassium concentrations exactly where they're supposed to be. It's like super duper important. So most of the time those concentrations are going to be what those concentrations are going to be and what they're supposed to be. But there are certain situations that can throw us out of whack, and so I'm just going to give you a couple of examples. The first example is hyponatremia. Hyponatremia means low blood sodium concentrations. Now what's normal, right, is that you have a really high concentration of sodium outside the cells, so usually about 145 millimoles per liter, right? And really low on the inside, I think it was like 15, right? So if, however, you have less sodium outside of the cell, so we're going to focus on this situation right here. If you have lower sodium outside of the cell, that means that the concentration gradient between the outside of the cell and the inside of the cell isn't as steep as it used to be because we have less sodium out here. We used to have a ton. Now we have slightly less compared to the little bit inside the cell. So what that means is instead of sodium like rushing in, it's going to be like, yeah, I'll go in, right? So it's going to slow down the speed at which the sodium moves in. So here we have a bunch of EPSPs that are summating temporally, and then we reach threshold, and then right, it takes a little while for the sodium to all rush in because it's not rushing quite as much. Whereas when you have normal blood sodium levels, I'll go back to yellow here, it's right, it's really, really fast because the concentration gradient is so high. You can get hyponatremia from drinking too much water. So that's one of the reasons why at marathons they'll have Gatorade and things like that, as well as little electrolyte pouches and powders and things. You can also get hyponatremia just by drinking too much water on purpose. Now, one of the interesting things about hyponatremia is because blood sodium levels are also really important for regulating osmotic action, or the movement of water via osmosis in our bodies. Most of the symptoms of hyponatremia, many of them come because of that, but you can also get like altered mental status, like hard to think, fuzzy thinking, because your action potentials are firing more slowly if you have low blood sodium. On the contrary, I want to talk about hyperkalemia. So hyperkalemia is high blood potassium levels. Now, again, potassium levels are normally very, very strictly regulated, and there's usually not a lot of potassium outside of the cells. Most potassium is inside the cells. Remember, there's only about 5 millimoles per liter outside of the cells and in the bloodstream. Obviously, potassium concentrations are really important for the electrochemical gradient and for all of the things that happen during an action potential. So there's normally so little potassium in the bloodstream, so little potassium in that extracellular space, that if you rapidly introduce a whole bunch of potassium into the bloodstream, say through an IV infusion, IV fluids that contain potassium, like the one shown here in the picture, you can raise that extracellular potassium level way too high really quickly, and it totally messes up the ability of cells to send an action potential. So what happens is you can kill someone, and I actually know an older physician who in their very first year out of medical school went to give somebody some potassium through their IV and either never learned or forgot that you have to give potassium very slowly if you give it via an IV, and they killed the patient. Right? So a rapid injection of potassium is fatal. Many states have used it for lethal injections for people who have the death penalty. So this is no joke, okay? Now, how does it actually kill people? What's interesting is that you may remember that muscle cells are also electrically active. So they're also electroactive cells. They also send action potentials. And so that's also true of cardiac muscle cells. So the reason why a rapid infusion of potassium into the bloodstream is fatal is because of its effect on the heart muscles, and totally ends up basically stopping your heart, which is then fatal. So all potassium containing fluids in the United States, and probably internationally, I should find out, have this red label. It always has a red label so that you know that that is a potassium containing fluid, so you cannot deliver it quickly through the IV. You can only infuse it slowly because it contains potassium. Never, ever, ever, ever rapidly open up a bag of fluid that contains potassium. You can kill your patient. So this is also why, like if you work in healthcare, you'll learn that if you're sending your patient, say, down for a CT scan or something, so they're, going off your floor, they're going to go somewhere else, you never send a potassium containing IV with them. Because if something happens, right, if they start to code or their blood pressure drops or something like that, one of the things that we'll often do is rapidly give IV fluids, and you don't want that to accidentally happen. So you either cap it and take it off, or you replace it with a non-potassium containing fluid when you send your patient down. Now, interestingly, you'd say, well, wait a minute, the neurons in the brain also need to send action potentials, but remember the astrocytes, remember the blood-brain barrier. So what's interesting is that they are relatively protected from a sudden increase in extracellular potassium due to high blood potassium levels. So it is the heart effects of a rapid infusion of potassium that are fatal, not the potential brain effects. The brain is relatively protected from that. Okay, so we haven't killed our patient by rapidly giving them potassium. So let's talk about why the action potential only goes in one direction. It only goes from the axon hillock down to the axon terminal. So this GIF is just showing you how it is one way. So we start off seeing those little yellow plus signs outside of the cell and blue minus signs inside of the cell, because at baseline, at resting membrane potential, the inside of the cell is negatively charged. When the action potential occurs, sodium ions, which are positively charged, rush into the inside of the axon, thereby flipping the charge and making the inside of the cell relatively positive compared to outside. And then that continues sequentially down the length of the axon. So why does it always continue sequentially down the length of the axon? Why doesn't it kind of jump around? Let's take a look. Jump around. Okay. So I like this diagram, but there is a typo, so we'll get there in a minute. I'm going to change my highlighter color. So when the action potential first starts at the axon hillock, voltage-gated sodium channels open. Sodium moves inside of the cell with its positive charge. That causes a depolarization of that section of the axon. So then this next section of the axon, its voltage-gated sodium channels are going to open, and sodium is going to rush in there. Now, when sodium rushes into the axon, it's not going to want to go proximally. Let's see, I'm going to change to the pen, I think. Okay, so they're using green for sodium. So here comes sodium, right? It's rushing in. When I'm rushing in here in the second one, I don't want to go this way because there was just a whole bunch of sodium there that rushed in. Just in the one above, right? Just before that. So I'm going to go this way for the most part, which is going to trigger these voltage-gated sodium channels to open. So that's why it's going to go. Also, additionally, even if some of those sodium ions, because some of them will, because they're difficult now just because of life and physics, right? Some of those sodium ions are going to go back this way. But those sodium channels are in their inactivated state by now. They're in their absolute refractory period. So I can't go that way, and trigger another action potential or make an action potential happen over there because they're all refractory. So I have to go this way. So that's why we see down the length of the axon. I want to point out the typo, which is right here, right? So, and I don't know, like what's, yeah, these should be pluses, right? And these should be minuses inside the cell. Typo. All right, let's talk about strength of the signal. Action potentials, remember, are all or nothing. There's no such thing as a stronger one or a weaker one. The voltage changes are always going to be exactly the same in terms of their maximum depolarization and then that repolarization and undershoot. It's always going to be the same. So therefore, when it's a sensory information coming in through your neurons, how do you tell your brain whether it's a bright light or a dim light, a loud sound or a faint one, a hard punch or just a light tap, a little boop on the nose, right? Or going the other way, so instead of sensory, going motor, when your brain is sending signals out to your body, how do you tell your muscles to contract just a little bit to pick up something light like my reading glasses versus something really heavy like the table here? So how do you give strength of a signal? Because action potentials are always the same. One size fits all. The answer is frequency of the action potentials. So here's what that looks like, again, with a diagram from the Hedges textbook. So a typical low strength stimulus is shown here. So there's a low strength stimulus. We get a bunch of EPSPs. We send an action potential. Then we have to wait for enough EPSPs to summate, and we get another action potential. Whereas down here, we have a stronger stimulus. It's the same duration. It lasts the same amount of time, but it's just bigger, right? So it's stronger. I'm pushing harder instead of lighter. So what's happening is it might take us a moment, but then, oh, there's so much stimulation, so many EPSPs coming in. We just go boom, boom, right? As soon as we're finished with one action potential, we're back at our threshold again, and we're sending another action potential. So it is the frequency of those action potentials that is what we use to signal this, to determine the strength of the stimulus. So for sensory information coming in, if it's a bigger thing, we have higher frequency motor information coming out, telling my muscles how hard to contract, right? It's the frequency of those action potentials. All right, so we reviewed characteristics of action potentials. They are one way and all or nothing. They are unidirectional or one way because of those relative concentrations of sodium, right? So proximally toward the axon hillock, there's a lot of sodium there because it just rushed in, so I'm going to go the other way. And also refractory periods. So even if I went that way, like those gates are inactive. They are no-go. So those refractory periods are absolute when the sodium gates have just opened, because hello, I'm just in the middle of one, and when they inactivate, when that little bead closes off the pore. And then we have a relative refractory period while those potassium gates are open. Potassium is moving out of the cell and we go in undershoot. So we're even more negative than the normal resting membrane potential of -70. So it's even harder then to get us to threshold of -55. So it requires a much stronger stimulus, many more EPSPs, many more excitatory postsynaptic potentials to get us to threshold. In terms of speed of propagation of an action potential down the axon, it's going to be faster if we have a wider diameter axon versus a skinnier one. You remember the straw example. It's also going to be faster if we have myelin and if we have lots of myelin. So we can do that saltatory conduction where we skip from node of Ranvier to node of Ranvier, and we're blocking those potassium leak channels that are going to kind of antagonize or fight against us. Then lastly, the strength of a signal is communicated by the frequency of action potentials, because action potentials are all one size fits all. So in order to communicate the strength of a stimulus or how profound it is, you have to just do it. So it's like, instead of me saying go, I go go, 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 right? So that it tells you kind of the strength of the signal. So that is it for action potentials. Lots to chew on there. So if you have questions, let me know.